Hello, everyone. I'm Jing, a colleague of Dr. Tang's, both of us from the same hospital, Cancer Hospital, Chinese Academy of Medical Sciences. It's our great honor to present our phase 2 results of the STELLAR-2 trial, which investigate preoperative short-course radiotherapy followed by chemotherapy and the PD-1 inhibitor in pMMR locally advanced rectal cancer. Preoperative chemoradiotherapy has been the standard of care for 20 years. Despite some advances in total neoadjuvant therapy, the CR rates remain less than 30%, and the majority of the study failed to improve the overall survival. In terms of TNT, we previously conducted a phase 3 STELLAR trial, which demonstrates that short-course radiation-based TNT is non-inferior to standard of concurrent chemoradiotherapy with a better 3-year and 5-year overall survival, which has been just presented by Dr. Tang. In recent years, especially before the 2022, we have entered the era of the immunotherapy. We noticed that the phase 2 studies combining CRT or TNT with immunotherapy have reported CR rates of 30 to 52%, suggesting that aiding immuno checkpoint inhibitors may further increase the CR rates. However, seldom phase 3 randomized trial was conducted to demonstrate that long-term benefit of the ITNT. Based on the finding of STELLAR trial, we launched the STELLAR-2 study to investigate whether the addition of a PD-1 inhibitor to short-course RT-based TNT can further enhance the treatment efficacy. STELLAR-2 is a multi-center, seamless phase 2 and 3 randomized control trial. Patients who were randomized into 2 arms. TNT group includes short-course radiotherapy, followed by 4 courses of chemotherapy. ITNT group, including the same regimen plus a PD-1 inhibitor, sintilimab, administered concurrently with chemotherapy. Patients who met CCR were allowed to wait-and-see policy of the neoadjuvant treatment. The key eligibility criteria was stage 2 and 3 pMMR adenocarcinoma of the rectal cancer with middle and lower sided. The primary endpoints of phase 2 was the complete response rate, including CCR and PCR rates. And the phase 3 was 3-year disease-free survival. Again, this study is a seamless phase 2 and 3 randomized control trial. For phase 2 trial, if CR rates could be increased from 22% to 40%, then it would be transferred seamlessly to the phase 3 study. A total number of 588 patients were needed for phase 2 and phase 3 respectively. Here we reported the results of the phase 2 study. This is a flowchart in which 110 and 108 patients were assigned to the ITNT and TNT group respectively. From August 2022 to November 2023, 218 patients were randomized. The baseline characteristics were balanced between the 2 groups. The majority of the patients had been stage 2-3, node positive, and 35% of the patient tumor were located less than 5 centimeters from the anal. All patients complete well short-course radiotherapy, with 88.2% in the ITNT group and 93.5% in the TNT group, completing 4 courses of neoadjuvant chemo with sintilimab or chemotherapy alone, respectively. As for adjuvant treatment, nearly half of the patients received full dose of chemotherapy. About the toxicities, Grade 3 and 2 adverse toxicity were reported in 34.5% of the ITN2 group and 19.4% of the TNT group. Importantly, no unexpected severe toxicity events occurred, and aiding sintilimab did not increase the surgical complications. The CR rates in the ITN2 group was 45.5%, which met the primary endpoint and was significantly higher than that in the TNT group. Moreover, about the 29 patients who adopt a wait-and-see policy, only 1 patient in each group developed regrowth, although the interval of the follow-up time is very short. Among patients who underwent surgery, the addition of sintilimab did not affect R0 resection rate, and ITN2 group showed greater tumor regression with a PCR rate of 43%. In multi-variant analysis, clinical T4 stage and TNT treatment group, EMVI positive and elevated CEA levels as independent risk factors for failure to achieve CR rate. In summary, for PMR locally advanced rectal cancer, the combination of short-course radiation followed by 4 courses of chemotherapy plus a PD-1 inhibitor was well tolerated with no unexpected severe events. Notably, the CR rate was significantly improved using the ITNT strategy. Furthermore, our phase 2 study is almost approaching the end of the entire enrollment, and the final DFS results we're expecting. I would like to thank all the co-authors, participating centers, our patients and families for their great contributions. Thank you for your attention.
Thank you, and I